Imagine walking out of a hospital room after months of treatment, your body changed, your mind exhausted, and your spirit both relieved and shaken. Cancer has left its mark not just physically, but emotionally, mentally, and spiritually. Most people see the smiles, the hair that grows back, the outward recovery. But the truth is, the journey doesn't end when the treatments stop. Healing after cancer is not a linear path, and it's rarely simple. Survivors carry invisible scars, and there are things they wish everyone knew, lessons learned in the quiet, painful, and often deeply transformative moments of recovery. Today, we are going to explore the truths cancer survivors hold close, the insights they wish others understood, and the practices that help them reclaim not just their lives, but their sense of self. These are stories of resilience, courage, and the delicate art of rebuilding. Healing is more than physical. One of the biggest misconceptions about cancer recovery is that it's purely physical. People assume once the chemotherapy, radiation, or surgery ends, the survivor simply goes back to normal. But cancer touches every aspect of a person's life. Physical healing is just one part of the journey. Emotional, mental, and spiritual recovery often take longer, and sometimes those wounds are invisible to the world. Survivors wish everyone understood that fatigue, anxiety, and lingering fear are real and valid, even years after the diagnosis. They wish people realized that a healthy body does not always equal a healed mind. The sleepless nights, the panic when a new ache appears, or the constant questioning of, "Am I really okay?" These are all part of the aftermath. Healing is a total process that requires patience, understanding, and empathy from both the survivor and those around them. Fear doesn't end with treatment. Survivors carry a shadow that often goes unnoticed, the fear of recurrence. Even after every scan comes back clean, a whisper in the mind asks, "What if it comes back?" This fear can linger, affecting daily life, relationships, and choices. Survivors wish others understood that their anxiety is not paranoia. It's a natural response to having faced mortality head-on. It's easy for friends and family to say, "Don't worry, you're fine," but those words can feel empty. Survivors find comfort not in reassurances, but in understanding and acknowledgement. A simple, "I can't imagine how hard this is, but I'm here," holds more power than any generic encouragement. Accepting that fear is part of the healing process allows survivors to address it openly, seek help when needed, and slowly reclaim their sense of security. Recovery is non-linear. Another truth survivors wish everyone knew is that healing isn't a straight line. Some days are full of energy, optimism, and gratitude. Other days bring exhaustion, frustration, and despair. This roller coaster can be confusing, especially for those who expect a survivor to bounce back immediately. Survivors wish people understood that setbacks don't mean failure, and bad days don't erase progress. Every small victory counts, finishing a walk, cooking a meal, or simply getting out of bed after a long night of anxiety. Healing is about consistency, not perfection. It's about showing up for yourself, even when your body or mind protests, and celebrating every step forward, no matter how small. Emotional healing requires permission. Cancer forces you to confront emotions you may have ignored your entire life. Anger, grief, sadness, fear, and even guilt can emerge unexpectedly. Survivors wish the world understood that emotional healing requires permission. It's okay to cry. It's okay to be angry. It's okay to feel vulnerable. Many survivors spend months or even years feeling like they have to put on a brave face for others. They smile, attend social gatherings, and answer questions politely, even when inside they feel fragile. But true healing happens when survivors give themselves permission to feel without judgment. They learn that acknowledging emotions is not a sign of weakness, but a step toward reclaiming their inner power. Support matters, but not always in the way you think. Cancer survivors often discover that support is complicated. People offer advice, tell stories, or give suggestions that may seem helpful, but actually feel dismissive. Survivors wish others knew that listening is more powerful than speaking, that presence matters more than words, and that sometimes the best support is simply sitting quietly, holding a hand, or acknowledging the struggle without trying to fix it. Support can also be about understanding boundaries. Survivors may not want constant updates, photos, or intrusive questions. Respecting their need for space doesn't mean you care less. It means you care wisely. Emotional support, when given with sensitivity and patience, can make a tremendous difference in how survivors navigate the long path to healing. Body image and identity can shift. Cancer changes the body, sometimes drastically. Surgery scars, hair loss, weight changes, or chronic fatigue can alter the way survivors perceive themselves. Survivors wish people knew that their journey includes redefining identity and self-worth. Healing is as much about accepting the new body as it is about treating the old one. Compliments meant to reassure, like "you look great," may be appreciated, but they rarely address the deeper struggle of reconciling who they were with who they are now. Survivors often benefit from spaces where they can express fears about appearance, discuss body changes honestly, and rebuild confidence on their own terms. Understanding this aspect of recovery fosters empathy and reduces pressure to appear perfectly healed. Spiritual and mental growth is part of the journey. Cancer has a way of shaking core beliefs and forcing existential questions. Survivors often experience profound spiritual or mental growth. They reassess priorities, relationships, and life goals. Survivors wish people knew that the journey is not just about survival, it can be about transformation. Many survivors discover a deeper sense of purpose, renewed appreciation for life, and a desire to live authentically. They learn to embrace gratitude, even for small joys, and to prioritize what truly matters. While cancer is devastating, it can catalyze insights that might never have arisen otherwise. Understanding that healing can involve both pain and profound personal growth allows others to see survivors not just as patients, but as individuals, reclaiming their lives with newfound depth. Fatigue is real, even when you look fine. One of the most frustrating aspects of post-cancer life is fatigue. Survivors often look healthy, even radiant, but feel drained inside. Daily tasks that used to feel effortless may now require careful planning and energy management. Survivors wish people understood that fatigue is real and doesn't always correlate with appearance. Comments like, "You seem fine," or "Why don't you just rest?" can feel dismissive because they don't acknowledge the invisible struggle. Fatigue after cancer is not laziness. It's a physiological and emotional response to trauma. Recognizing this reality allows friends, family, and colleagues to offer practical support, patience, and understanding, making the survivor feel seen and validated. Mental health is as important as physical health. Survivors wish everyone knew that mental health is a critical component of recovery. Anxiety, depression, PTSD, and cognitive changes are common, yet often overlooked. Just because someone looks healthy doesn't mean their mind has healed. Therapy, support groups, mindfulness practices, and meditation can be essential tools in restoring emotional balance. Acknowledging mental health challenges is not a sign of weakness. It's a step toward long-term wellness. Survivors benefit immensely from environments that normalize seeking help, reduce stigma, and encourage holistic care. Mental, emotional, and physical combined. Emotional resilience is just as critical as medical recovery, and supporting it should be a priority for everyone who interacts with survivors. The power of self-advocacy. Cancer teaches survivors the importance of self-advocacy. Navigating medical systems, making treatment decisions, and managing long-term effects often require assertiveness and informed decision-making. Survivors wish others understood that advocating for themselves is a strength, not stubbornness. They learn to ask questions, set boundaries, and seek the care they need. This empowerment is a vital part of healing, helping survivors regain control over their bodies and lives. Supporting a survivor means respecting their choices, listening to their concerns, and trusting their judgment about what feels right for them. Gratitude is complicated. Many survivors express gratitude, but it's often complex. They are grateful for life, love, and support, yet they can simultaneously feel anger, frustration, or sadness about what they lost. Survivors wish people knew that gratitude doesn't erase pain, it coexists with it. Understanding this complexity allows for deeper empathy. Survivors are not expected to feel perfect all the time. Recognizing that gratitude can exist alongside fear, grief, and exhaustion creates space for authentic connection and support. Survivors wish the world knew that healing after cancer is not about returning to life as it was. It's about creating a new life, infused with resilience, perspective, and courage. It's about embracing vulnerability and strength simultaneously, and about finding beauty, meaning, and purpose in ways that were previously unimaginable. Healing after cancer is messy, unpredictable, and deeply personal, but it is also profoundly human. And if we listen, respect, and understand, we can offer survivors something far more valuable than advice or sympathy. We can offer recognition, empathy, and space for them to flourish in the life they fought so hard to reclaim.